Nequin, we are ready when you are.
Countdown in 5, 4, 3, 2, 1.
Good morning, everybody. This is a joint committee session of our Education and Culture and Health and Human Services Committee. Today we will be discussing the proposed FY22 operating budget and specifically early childhood care and education services, child care subsidies, infant and toddlers, high school wellness centers, and the Children's Opportunity Fund. I want to first express my appreciation to the county executive and his team. The proposed budget that has been sent over from the Health and Human Services standpoint clearly does have a focus on an emphasis on our social safety net. But as is always the case, the council now has the opportunity to deliberate and discuss the items that have been recommended. We're also fortunate to continue to have such a strong infrastructure here in our community and county with tremendous community-based organizations and civic partners that form this really powerful team that does a lot of great work and has certainly been tested this last year. We're joined today as well by my colleague and friend, Councilmember Andrew Friedson. And of course, we have from our HHS committee, Council Members Glass and Rice, and chairing our Education and Culture Committee is Councilmember Rice, and we're going to be tag teaming this today, but I will be facilitating the discussion. So if you'd like to speak, colleagues, just text me. And Councilmember Navarro, it's great to see you. And we hopefully will see Councilmember Jawando a little bit later this morning. So with that, Ms. Yao, I will turn it over to you to tee this up and walk us through the packet.
Sorry, good morning, I had to unmute. The Joint Committee today is going to be reviewing and making recommendations on the Executive's Fiscal Year 22 operating budget items that involve the Department of Health and Human Services and Montgomery County Public Schools or are education related. The first part of your packet is really looking at racial equity and social justice. The service area collects both quantitative and qualitative data to track and coordinate program access, services, and outcomes for different population groups. The service area is focused on promoting well-being of children, youth, and caregivers, and works with some of the most vulnerable populations in the county, including low-income and Black and Brown populations. You know, a little bit different than other departments in the county, it is the goal of the service area and the programs in it to provide or to develop equitable and inclusive health and human services systems that are responsive to racial, ethnic, and economically disinvested communities. If the Joint Committee is interested in delving more deeply into the data and outcomes of the Children, Youth, and Family Services programs, it may want to schedule a separate session outside of budget review. So on that note, we can just jump into the different areas that the Joint Committee will be reviewing today.
I'd like to just make a quick suggestion. There's obviously a lot to speak through in this packet, and I think rather than wait for all the presentations to be complete, because they're so nuanced and don't want to make sure anything is lost in the shuffle, we will stop after each section to do a Q&A, and that may mean a little bit of a longer session this morning, but obviously this is an important subject, and so we are going to tackle it that way. Councilmember Navarro would like to make a few comments.
Thank you, Mr. Chairman, and good morning to everyone. On this particular section, I wanted to just comment that I recognize that we've been quite overwhelmed with issues of responding to the pandemic, and everybody has been spread very thin, and I recognize that. But I do want to remind us that the legislation really calls for comprehensive data that we can then react to both through legislation, which is something that obviously our OLO department will do for us in terms of impact notes, but also every budgetary decision. And so although I appreciate this section that has been included, I do believe that we need to get into a routine of making sure that the information is comprehensive. I don't think it's acceptable to have to then come back after we've made the budgetary decisions, because the whole point is for us to methodically make decisions that in an additive nature contribute to eliminating these gaps. And so just looking at some, qualitative examples, it's not what the legislation was intended to do. So I want to register that, Ms. Yao, and also for, as we move through this process, and make sure that obviously we have ample time, in other words, you as staff, to gather this information before we have to make decisions. So anyway, just want to be on record with that, because to me, the information that was included really doesn't do justice to the legislation that we all supporting. Thank you.
Fair point. Ms. Yao? And actually, I apologize. Chairman Rice, did you want to make any opening comments?
Yeah, thank you. And I really want to piggyback on what Councilmember Navarro has said, because when we look at what we've always talked about in terms of really truly eliminating some of the equity gaps that exist in our school system, it starts with early care and education. And that is at the forefront and the core of what it is that we are trying to do here. And so along those lines, more robust analysis around that is incredibly important to justify and identify why it is that we need to do this, what it is that we need to do to really make a difference in the lives of our children and our parents and their families overall. We're talking about breaking systemic generational poverty by having folks who now are connected to high quality access for education that's affordable. That's a big deal, and that needs to be spelled out as to why this is just so important. I know that Councilmember Navarro has spent pretty much her entire professional career focusing on this, and so it really is one where, in my work on the Curran Commission, we identified this, and I led the special sub working group on this topic. There's so much information that is out there, and so I just really agree with what Councilmember Navarro said, and also just want to highlight why this work is so important, why it is so instrumental in terms of everything that we talk about when it comes to equity and social justice, and so certainly want to lift that up. So thank you.
Thank you, and we're frankly all better off because she's dedicated her lifetime to this work, so we really appreciate it. Ms. Yao, why don't you, back to you to walk us through this first section.
Sure, and we'll make sure that we get that information briefed for the Joint Committee in the future. I can say that, the work going on in these service areas certainly looks at, where the need is. OLO has done work on that as well, but again, we'll need to take more time so that we can have that information comprehensively briefed for the Joint Committee in the future, at least. So the first area is early childhood care and education services. As everyone knows, the expansion of quality care, early care and education has been the focus of multiple groups in the county and in the state in recent years, and the need for public support of private early care has intensified with the pandemic. This section will summarize initiatives that have public funding implications for the county in fiscal year 22. The council has received testimony supporting funding to expand quality early care and education programming, including universal pre-K and subsidized childcare for young children, and that's attached to your packet as circles 40 to 48. The first item, which is actually a bit of an umbrella item, is the early care and education non-departmental account, or NDA. For fiscal year 22, the executive is recommending a budget for the NDA of $10,992,589. It's an increase of $5 million, or 83.4% over the fiscal year 21 level. Fiscal year 22 is year 3 of a 4-year action plan, which is focused on strengthening the county's early care and education system and supporting the expansion, access, and sustainability of quality early care and education programs throughout the county. The initiative is focused on expanding the number of quality early ECE seats in a mixed delivery system, ensuring the sustainability of family and center-based programs, increasing resources to providers and families, identifying existing unused or underutilized classrooms in high needs areas, and increasing utilization of local childcare subsidies, as well as supporting recovery work during the COVID pandemic. There is a table in your packet, page 5 of your packet, which summarizes the budget and the recommended funding for fiscal year 22 and the budget and expenditures for fiscal year 20 and fiscal year 21. However, we received an updated table after the packet was published, and that was circulated to council members yesterday. So I'm going to be referring to the updated table, and the difference in the updated, there was a mistake in the table that was published in the packet, and it includes 1.2 million for interpretation services for children in the infants and toddlers program, and that amount of 1.2 has been redistributed to support childcare subsidies as well as additional seats, early care and education seats. The bulk of the available funding in fiscal year 22 is targeted at those two items, as well as developing a website and portal, the Family Involvement Center and Montgomery College educational scholarships. And there's also funding for a shared services model that supports providers. The Joint Committee will be reviewing some of the funding that's reflected in the table, namely childcare subsidies and adjustments in early childhood services, momentarily. There's a couple questions regarding personnel costs in terms of, there's an increase in $516,992 in fiscal year 22. And so the Joint Committee may want to hear from HHS about, what positions are being added and what they will be doing. And there's also a significant increase in management consulting costs. So again, the committee may want to hear a little bit more about the details in what's being planned for fiscal year 22.
Thank you. Councilor Navarro has a few points or questions that she'd like to ask, and then I'm going to turn it over to Dr. Kroll, Ms. Barnes, and anybody else who's in a position to speak to this first section.
Thank you, Mr. Chairman. I guess the first observation I will make, Ms. Yao, is that when you describe the development of this 4-year action plan, you failed to include the fact that I was the author of the plan with inputs from all of these agencies. That's fine, but if you can just please update that in the packet. The second questions I have to do with, I would really like to hear just a little bit. I know that there are some tables that are included, but just a little bit on where we are, if we are on target with the goals that have been identified for this 4-year action plan, because that's super important. Obviously, the funding tracks or should be tracking the sort of progress and preparing to make sure that we are, completing those targets. So those metrics are going to be important. And so as Dr. Kroll and Ms. Barnes talk, hopefully if they're going to give us an update on these two issues that you've identified in terms of personnel and management consulting funds, if they can describe how that is attached to these goals that we're trying to attain. And then sort of related to that, the issue of interpreter services, I was puzzled by that. I appreciate the clarification. I know that the executive had mentioned in his budget announcement that they would be creating some sort of interpretation unit or translation unit. I know it's something that I've been asking for a long time because MCPS has had one that we all worked on when I was on the Board of Education. So I don't know if that's somewhere else. I realized that this was erroneously reflected here, but just wanted to understand again, where are we with the 4-year action plan? And have we made progress, even though we have been dealing with a pandemic? I had heard that we were, and for that I'm so grateful, but just wanted to hear a little bit of that as folks respond to these two issues of personnel and management consulting. Thank you.
Thank you. Dr. Kroll, Ms. Barnes, and anyone else that's in a position to speak to the first section. If you could, hopefully you're taking notes regarding Ms. Novato's questions. And if you could respond, we'd appreciate it.
Sure, I think we're going to need access to video as part of that. So, but I think Joanne will certainly be able to, and Barbara will be able to talk to the specific details around the progress we've made on early child care. But I do want to start with an acknowledgement of you, Councilmember Navarro, for initiating this whole early child care and education initiative. It has been a pleasure to watch it unfold, and it will all be in no small part due to your commitment and drive to keep us going and on track. COVID, of course, has really thrown a wrinkle into this, and so I know that, but I do know that the CE is committed to making sure that it continues. That anything that we didn't accomplish this year and funding we didn't spend this year is automatically rolled over into next year, so that we can continue this process of building some recovery and keeping the work moving forward. So I won't belabor it. I will just turn it over to Joanne and to Barbara, I think, if necessary, to give you an update on where we are and what we're looking to do in the future.
Good morning, Joanne Barnes, Chief of Children, Youth, and Family Services. I'd like to just start off by just responding a little bit to the concerns about what we presented as part of our packet for racial equity. And I definitely don't want to do a disservice to all of the work that our team in Children, Youth, and Family Services has done. We definitely are collecting information that we can share with you about how our services are reaching into diverse parts of the community in order to achieve racial equity. I think from my part, it wasn't clear what you wanted, and I didn't think you wanted me to just give you charts with numbers on it. And my interpretation was that you would be more interested in examples of how we're actually implementing our steps to advance racial equity, because we definitely are gathering and analyzing the data from our program. We're definitely making moves to make sure that affected populations and stakeholders reflect where high need is in the county. We are definitely looking at some of the root causes of the inequality in the services we provide, and we're making changes to how we are able to respond to the populations that we serve in order to give them better access to both benefits and services. So we will definitely work with Vivian and make sure that we get the type of data that you want to see. And again, I just want to make sure that you know that our team is working hard serving the disadvantaged, both economically and racially, to make sure that we can help bring people to a point where they can have equal access and equal opportunity to succeed. So again, we will make sure we follow up with that.
Joanne, before you go on, I just wanted to note that what Joanne is speaking about in terms of CYF is also true for the department. We have been looking at data, and all of the programs that we've submitted have some statement about that, not quite to some varying degree of sharpness in data. I do think that once we get past session, as we get ready to roll into future years, we need to take a sharper look at what we need and what we want to report on. COVID has also given us, as you've seen in the equity profile, a way of using a better and sharper focus on using data to really determine where clients and people are vulnerable and how we reach out to them. So I expect that what we've learned in COVID will roll into the future planning.
I appreciate that. I will add that I do have a conversation pending with our staff director, because we did hire a racial equity specialist for the council. And I think it would be really critical, I'm sure my colleagues will agree, to have her meet with both, with Ms. Tiffany Ward to perhaps develop some sort of template, because I do worry that, again, the spirit of the legislation will not be, I think, honored if we have just different ways of presenting and or looking at the data necessary. And so that's why I preface my comments by saying that I know this is new and COVID-19 has really hit us hard. It's been difficult, but I do believe that it's going to be important for us to develop some type of template that then helps the council, as well as the administration, do that deliberate work of ensuring that whatever decisions we're making really are guided by this ultimate goal of closing, eliminating these gaps. But I appreciate, because I know you've all been doing it for a very long time. I think it's just a matter of how do we present that, how do we look at that, and how does our public also, benefit from seeing that as well. And the other thing I will say, because I would be remiss, is that really appreciate the fact that despite the pandemic, this work on the early care and education has continued. And as you know, we've all worked together on recognizing that we needed to provide some relief dollars to our childcare industry, because obviously it's so tied to the economic recovery. So I've been really pleased to know that sort of parallel track has been continued even through this very difficult, emergency.
Thank you. I see my good friend Luis Cardona may want to say something as well. I've gotten better at reading people's faces through Zoom.
Sorry, I'm muted. Yeah, I just wanted to add to what Director Crow was talking about and the importance of the work in HHS. We had a very recently we had a very robust conversation around the equity issue, but also in the sense of how do we best gather a lot of information. And that led to a very robust conversation that I was able to have with Karen Gutierrez, who I want to just acknowledge, who works on the Betty Lamb, because we really got in depth into the conversation about capturing the ethnicity as well as the race of our constituency, which I believe is going to be very important for us moving forward as we provide all these services. So, and that's all under the leadership of our director, and obviously, Betty Lamb, and I know Karen is new, but we did talk about as next steps bringing in some key folks in our management leadership to talk about those strategies about how we capture a more precise representation of the ethnicity, the full ethnicity of who we serve here at HHS.
Yeah, I'll just add 2 cents to this. Oh, go ahead, Councilman.
I'm sorry. No, that's very key. That is what the legislation is meant to do, because, of course, the county is very much a reflection of the country and the world, and so that is a very important observation. I always assume that is being folded into whatever is going on, but it's important to constantly remind ourselves that we have got to make sure that, as you said, we are incorporating and reflecting the breadth of the county's population, because we do have some nuances that are very unique to different communities, but they all come together, obviously, and affect the quality of life of all of those communities in the county. So I really appreciate that, Mr. Cardona. I know, and my colleagues probably will agree, because we discussed this ad nauseum during our leadership trainings and things like that, that this is pivotal and it's fundamental for the success of this major undertaking that Montgomery County has committed to do. So thank you for that, for acknowledging that and bringing that up.
So just a high-level summary, I think there's a universal agreement that a template will make sense moving forward, so that departments don't have to interpret what we're asking for, but be consistent. And then I'll also note that with that template, we'll be able to track year-over-year progress, so that we're all kind of working from the same framework, which will be helpful for future councils as well. So great. So thank you for those comments, Ms. Barnes and Councilmember Navarro. Ms. Barnes, back to you on this first section regarding ECE.
I believe one of the issues that council staff raised was a question about the positions that are included in the early care and education work. Do you want me, if you want me to elaborate on that, I can.
That would be great. We can start there.
Okay. So the amount that's reflected in the early care and education initiative budget does reflect the addition of positions that we feel are necessary to do the work. Out of the, what started as $7 million and now is in excess of $10 million that's directed to the initiative, we have been doing a lot of the work using contractual or broker staff in order to reach deeply into the child care community. We are not only using contracts, but we're also using the staff through the resource and referral team that connect with providers and help them through the process. So we initially requested, as part of the first year budget, that some positions would be created to continue that work. We have one key person that many of the family child care providers know and think the world of, but she can't do that work. She can't continue to do that work on her own. So these positions are a combination of 8 positions. 4 of them are directly related to the resource and referral team. Others are for early childhood mental health. One is for general administration in the early childhood services to make sure we can monitor and track the work that we're doing through the initiative. And then one is for the WPA program to make sure that we can stay abreast of the latest information that we get from the state and make adjustments to the WPA program in a timely fashion. That has continued to be a challenge, not because of the position, but because we're still negotiating with the state. And I understand some things have taken a back seat because of the pandemic, but we have not yet been able to get the regular downloads of information about Montgomery County residents that are approved for and receiving state child care scholarship program, because that's critical to us making decisions on where we go with the county program. So again, these positions are in order to further the work. It's I'm going to call it a one-time only increase to the staff it takes to get this work done. The first 2 years, we, again, definitely tried to do this work with our existing staff complement, and we aren't going to be as effective as we need to be if we don't bring on the staff to do the work. So that's what those positions are. I can give a specific chart related to what the positions are. I do have that, and I'll make sure that I give that to council staff.
I'll just say from 30,000 feet, Ms. Barnes, I don't think you're going to get a lot of disagreement that you all need an additional set of capable hands to get this work done, and we all agree that it's critically important. I do know it's been a challenge to onboard positions, in part because of the pandemic, but frankly, it was hard before the pandemic. So just, putting in a plug for cooperation and work with our Office of Human Resources. And I know Councilmember Navarro has done great work with the Government Operations Committee on oversight in streamlining and improving that process. But if there's anything we can do to help, just obviously let us know, because when we appropriate these positions, I know many times I've seen and have personal experience with, they do no good if they're just on paper and they're not actually brought on board. So, there, I know have been some lessons learned this last year. And I'll also note that I think certainly the council, and I believe the administration as well, has done a better job in recent years of making sure that our staff reflect the diversity of the communities that we serve. We've been very intentional about that. It's now literally written in law. But we often hear it's hard to find folks that, have these different sets of experiences. And we've had this conversation many times. And I know that we're preaching to the choir in terms of an emphasis on that. But even if it takes just a little tiny bit longer to onboard, just having the right folks in there, because they're going to be there a long time. And we want to make sure we get it right the first time. So just some general comments. You don't even need to respond because I know you agree with all that. My colleagues do as well. It's sort of like Captain Obvious. But I just wanted to get that on the record. So did any of my colleagues have questions regarding the positions that Ms. Barnes has proposed? Or not Ms. Barnes, but HHS. Thank you. Hearing none, let's move on to the next item.
Okay. There was a question about the amount of translation that was included in the ECI budget, and that was a mistake. I think we provided a corrected information that wasn't able to get into the packet in time. In fact, though, we have been impacted by a mandate by the state, an unfunded mandate, that based on the percentage of population's presence in the county, that we're mandated to offer all of our documents in the native language. Now, that works for us, but when it comes without funding in order to make it happen, that's where we struggle. So we have worked with the state to try and get additional funding for translation. They gave us a one-time only allocation. We have not been able to get additional money from them. So the ECEI account did support last year the translation expenses for our young children enrolled in the infant and their families enrolled in the infant and toddler program. But we have gotten additional money in the base budget, and so there was no need to request $1.2 million from the NDA account. So we are, that has been corrected. The last thing, if I recall, that we wanted to spend just a little bit of time to talk about, and I'm hoping that Dr. Andrews will cue herself up to be ready to back me up with just an analysis of where we are with the original goals of the ECEI initiative. So one of our main goals was high quality from birth in all settings. And I will say our work has been impacted by the pandemic, particularly the largest portion of our work, which deals with child care providers and the work that we've done with them, the work they've done to improve their status and professional training and education. That all was impacted. The child care provider world was just, I don't want to say decimated, but so impacted by the closures that came as a result of the pandemic. So it made sense that we focused on a different kind of support for them at this time. But we also did focus on creating more opportunities for child care staff to improve their education and improve their credentials while centers were closed. So that was an opportunity that we took, not that's this actual goal that I'm talking about, but I'll mention a little further under improving the workforce. We refocused some of what we were doing in other goals to improve workforce so that providers could take advantage of the time when centers were closed. But in terms of some of the high quality work that we did, we mentioned what we've continued to do with the infant and toddler program. We continue to maintain our family involvement centers, even though schools were closed. Our family involvement centers also took on a virtual position to make sure that we could continue to support young children and their families during the pandemic. We have staff who were engaged in creating activities that families could engage in online and could mimic the actions that they were trained to do with their children while their children were home. Barbara, is there anything else we want to say about the first goal, high quality from birth to all settings?
I think the only thing that I'd add is, the pandemic, as we all know, has really emphasized what was already a problem in early care and education, and it's the sustainability of programs. So all of the pieces that we've done that are directly related to support during the pandemic are supports in large part that child care programs need anyway. And so all the pandemic responses have been about, for child care providers, have been about sustainability. So I'd simply add that to the picture.
For the second goal, affordable and accessible child care, early care and education for all children, we did delay some of the contracts that we wanted to continue in terms of doing a cost modeling study, re-looking at the cost study that we did in 2017. Again, the market was just not stable enough for us to collect that type of data, but that is something that we will pursue in FY22. We do not have a wait list for the subsidy programs. The state has continued to improve and has taken the next step in improving their rates. We see an opportunity and have been studying closely the fact that of the 2,700 children in Montgomery County, which we still think is low, but of those that are enrolled in the state program, when we looked at our county program, we found that the majority of them, the state program is now, based on the change they recently made, paying more or the same as Montgomery County. So one of the things that we focused on is before we increase the income level for the WPA program, we want to look at making sure we really saturate our outreach efforts in the lower income families to make sure that we're reaching those families. And so our focus is going to be on a marketing and outreach campaign to make sure that we not only reach families, but that providers have a clear understanding of how they can help engage their clients into the subsidy program. So our immediate response is not going to be increasing or significantly increasing the income. Our response is going to be working in the community to saturate the messaging about child care subsidies and make sure that we are able to get more children enrolled in that support, particularly now when I think having that supervision is going to be important for them over the summer and as we continue into next school year in terms of reversing any slide that has occurred while children were in virtual learning. I think we've continued to work with our child care in public space program. We continue to support those providers as we have upcoming renovations in some of our sites. We also have been working with the Wheaton Park and Planning folks about expanding slots in the new building in Wheaton. We have also been in contact with a developer that plans to do developing in the Bushy Drive area to make sure that we can have a child care presence there. Again, trying to saturate the appropriate communities with additional options for child care. Before I move on to the third goal, Barbara, any comments?
I think you mentioned the portal, but one of the questions was the cost of management and consulting in the NDA. That is the development of a portal for WPA to move to a completely online application process that will also connect people who apply to other HHS services. And if you look at the action plan for the next couple of years, there is a plan to develop an app to make access more and to get people to the affordability piece of WPA, to make everything more approachable by young families who do not make phone calls to get information. And most of the time they don't even look at websites, they look at their phone. And so eventually this portal will move to being fed, I'll call it that, by an app. And that also is another goal in the initiative, is to align websites that are all related to birth to 5 in the county. So that's just an answer to why there's so many funds in management and consulting. It's a multi-layered step process. The portal is well underway, and they're holding, it looks great, and they are holding focus groups with many different people to see how well that it works. And it will be in multiple languages.
Thank you, Dr. Andrews. Just a quick question, and then my colleague, Councilmember Jawando, has a question as well. Back to something you said a little bit earlier, because it connects a couple of dots, Ms. Barnes. I think we're all very excited about the translation services aspect. As Councilmember Navarro has mentioned, it's something we've all been pushing for a while, so it was exciting to see that in the recommended budget by the county executive. Can you talk a little bit more about scope and how that group will be involved with, for example, what Dr. Andrews just mentioned, the development of that portal, ensuring that it is accessible from a language access standpoint, so that we create this great tool, but make sure people can actually use it?
Absolutely. We've learned a lot through the pandemic, having had to stand up some intake applications quickly. And I know that initially we had some struggle with in translating those platforms so that all of our families can use them. Those lessons learned have definitely been transferred into this app that Dr. Andrews mentioned. We definitely are translating into at least 6 additional languages so that families can use both the portal when it opens, and that work is already starting in FY21. And the feedback loop with the app, that's work that would be funded in FY22. But all of that will include translated platforms, not platforms that are translated through another engine. But we are very careful about making sure that we do that correctly.
Great, thank you. Councilmember Jawando.
Thank you, Vice President Albornoz, and good morning to everybody. And thank you for all your work, as always. I know this is difficult. It's so important, and you're working really hard. On the couple things related to the marketing and outreach and the consultant costs that we were just discussing. You mentioned something, Ms. Barnes, that I know we've talked about before, in that we really want to make sure we have a full understanding of what the need is and who we need to serve at what levels before changing eligibility, which I agree with that statement. As part of this money, you have the demand study and marketing analysis, which obviously I'm assuming will inform how this outreach is done and what the answers to those questions are. Is there anything you can share about what we know right now and what we're hoping to find out, and how that might inform how we do our, use this money on these consultants in the case of marketing and outreach, but particularly with an eye towards narrowing in on the population, what you just described? Hopefully that makes sense, what I'm asking. And I can clarify it if it doesn't.
Yes, that would help, please.
So what are you going to use the demand? What do we know? Has any money been spent already? And what do we know about the demand and market analysis? And then how do you plan to spend this money that's in this budget on marketing and analysis to get to the point that you made of targeting the funds correctly?
Joanne, I can answer that. I think you're specifically speaking about a marketing, a supply and demand study. Is that what you're referring to? Okay. Yeah. We did have to put off an RFP for doing the supply and demand study because of the pandemic, but we are getting ready to get one out to find an organization that is skilled in early childhood, skilled in equity, and knowledgeable about how to do a supply and demand study for early childhood education. The marketing piece of that, doing a marketing analysis, was actually raised by directors in the field, and it does apply in some cases to directly to our child care and public space and how we make determinations as to where we put those programs. Sometimes we're putting them in places that makes it difficult for the child care program to succeed. and because of other programs that are nearby that are pulling children from their program. And then in terms of the CIP work that's going on for changing the program of requirements for how we build these childcare programs, this is part of our looking at all the modular buildings that have to be replaced. We are planning larger sites because for a number of years, the sites that have been built in schools for public space have been one room. And it's just not viable for childcare providers to, unless they're a much larger organization and they can balance it. So I don't know if I've answered your whole question, but I think you're talking about the supply and demand study specifically.
Yes, I was looking at that item in the budget, it's part of the consultant services.
Right.
I think there's 300,000 for this year, and we had been talking about this supply and demand study. I feel like since I got on the council, I know we had a pandemic. It's a key piece of the puzzle, and so I think, and we don't have to do this today, but I would love to see what that RFP and what you're actually asking for and what we hope to find out and accomplish in that supply and demand study. I think that will be helpful, and to the extent that it's already out there, even knowing it or being able to provide some feedback, that if we could follow up on that. And I agree with the size of and I'm glad to hear that the directors gave that feedback and are talking about the size of the actual centers. So I just think we have to know this information on supply and demand to really make smart decisions about how we move forward. So, okay, that's my question for now. Thank you.
Thank you. Councilman Navarro.
Thank you. That's such a good question as a follow-up by Councilmember Jawanda. I do believe, and I think we do need to have a subsequent session because I do believe that we have had some data regarding the mapping of where we have gaps. I know that work started, and so it would be great to have a session to take a look at that again and then superimpose the slots that have been expanded since the beginning of this initiative. That was something, it's something that I know I would like to see again, because I know that there had been some expansion of slots thus far, and it would be important to take a look at that. I think that is also going to be critical as we do the post-COVID-19 recovery, because then we can figure out what kind of technical assistance those providers or, those folks that have those expanded slots, number one, are they ready to, get to work? And number two, do they need any technical assistance? So I think for the chairs, it would be great to have a follow-up just to focus on those real specific, not so much on a big presentation about everything, but just like the specific things that have been accomplished, and then how is that going to be leveraged as we do the post-COVID-19 recovery. In terms of the app and the portal, I was just wondering if Ms. Director Roper has been involved in any way with this effort. I know that just yesterday, we did take up the change of the name of the department because it is being, in many ways, I think, reconfigured to be a lot more involved in things like this. How has there been any particular interaction with DTS in terms of this particular work, and will they be involved in any way once it's developed for maintenance or anything like that?
Absolutely. From the beginning, we have been working with Director Roper. And we were just in the early phases of planning this when she became the director of DTS. So she and her team have been involved since day one. Mm-hmm. They work closely with our team. We're using consultants that have been vetted through DTS, and they all work closely together on the planning of the prototype, that's the word I was looking for. And as they reveal different phases of it, it is definitely a combined effort. I think we feel really confident that having their help and support only will make this a better product.
Councilmember Navarro,
yes.
The county executive has been very clear throughout this year that anything that we're looking at in terms of technology services and supports, especially apps and front-facing services, is reviewed, and that we engage DTS in that process to either see whether or not there's a broader application than we're thinking of that might be useful, and or to make sure that it is the best application and meets county standards. So she has been and will continue to be a part of anything that you hear us talking about going forward around technology and developing new technology services.
Awesome. That's really good news. Yes, somebody else is missing something.
Yeah, I just wanted to say one piece about the marketing and outreach. We've taken a close look at the number of children that are served in Montgomery County compared to the number of children that are in Montgomery County that we believe would have access or would have a need for childcare. Right now, we are reaching, for the group between 0 and 5, we're only reaching, even with the 2,700 children that we know we're serving, we're only reaching about 5 to 6% of children in that age range. We know that all children won't need childcare, but we would like to see our reach in that age group improve at least to 15%. We'd like to be able to triple that. And that's why the marketing and outreach, it's not just to help support providers, it's to help support the families and give them what they need in order to be successful at work and furthering, parents furthering their education and so forth. So we do have a lofty goal that we want to make to expand the reach of childcare in the 0 to 5 age group.
Yeah, so going back to the interface with DTS, I would also like to schedule, Ms. Yao, I think we need to work with Dr. Tarangas to schedule a GEO session to kind of align all of this, because DTS obviously falls under GEO, and there are a lot of things that are happening right now with ITPCC that this would definitely fit into. So I would love to have a follow up on that. And secondly, what Ms. Barnes, you just said, I mean, that is the #1 priority of this initiative. I think as Dr. Kroll has led so ably through this pandemic, I think our outreach and engagement efforts through this pandemic are definitely going to serve as a permanent template for so many other things, through our hubs, through the teams, everything that has been stood up to this pandemic, I believe is definitely a best practice for Montgomery County. And we should definitely leverage that in terms of this particular space as well, because as you said, it's connected. So I want to offer that we're very lucky that we have been able to stood up and brought into the floor an incredible best practice that will serve us so ably, on all of these other policy areas. And I think we can get there. Thank you.
Thank you. Ms. Lambert wants to chime in, and then Councilmember Glass has a question.
Yeah, I just wanted to offer that as part of the budgeting process, departments who want to make IT improvements or enhancements need to submit them to Department of Technology Services, where they are reviewed, and DTS will tell OMB whether they are concurred in or not. So it is part of our budgeting process to take a look at that. And DTS is very much involved in that process.
Good to hear. Councilmember Glass.
Thank you very much, Mr. Chair, and good conversation about fully integrating all of government agencies and services. Really, really important stuff as we try to do more with less, or do more in a more efficient manner, at least. And so, I'm just looking at the cost chart here, and the only question I have, just listening to my colleagues' good questions, is all of this outreach proposed or to be done in-house? Is there any external cooperation or partnership with any of the community groups that we rely on in so many different other areas with regard to outreach?
Yes, we would not be doing all of the work internally. We think some of the best capacity will come from working with our nonprofit partners to help us do this work. And that would include the work that we've done with Montgomery Moving Forward. It would also include work with some professional marketing firms that know how to do this work and can advise us on what can be most effective. So we do not intend to do all of this in our own in our own unit.
Good. Well, I'm glad to hear that. There are, as you noted, and we all know, incredible community partners and professionals to do this. But just circling back to the point I made and that others have stated, I think fully integrating our communication channels, particularly with DTS and other areas in county government, would benefit all of us and would most certainly benefit our taxpayers as we try to do more. So, okay, thank you.
Thank you.
I just, the last two areas in the ECEI plan, I mentioned briefly our goal number 4 is about improving the professional credentials of our workforce. And I had mentioned already that we have spent a lot of effort, even during the pandemic, to increase opportunities and to defray the costs for not only child care directors and owners, but also for their staff. So that is work that we will continue to do. Councilmember Navarro also mentioned the progress that we made in our first year, where we were able to do so much with, and we're actually ahead of schedule with what we thought we would do to improve family child care in the county. We have maintained connections with those providers and are working with them to make sure as the child care world begins to get back to normal, that they have what they need in order to continue the course of opening their businesses. And then lastly,
Joanne, can I add one thing?
Absolutely.
Or actually two. Part of what we do when we support the family child care providers, but not all of what we do, but part of it is giving them business supports. And we have a very strong relationship with the Women's Business Center and with nonprofit Montgomery. The Women's Business Center is our usual go-to for business supports. Nonprofit Montgomery has also been brought in to help with the grant, the $10 million grant that was put out by the council, because they needed help in knowing how to apply, knowing how to sign a contract, knowing how to do the reports, et cetera. But I wanted to mention that since July of 2020, we have actually recruited and they have gained their registration for doing childcare, 21 more family childcare providers. I thought it was fewer than that, but I just recently received the report. So that's the possibility of 142 new seats. The current enrollment is 84 children. We are in the middle of a pandemic. There are 18 of them are participating in Maryland Excels. 15 have attained an association membership, and 11 of them were part of those who were awarded ECI grants. So for relief grants.
Also, we had a recent update from Montgomery College, and they are strong partners of the initiative. Just last week, we had an update where they were able to report that even during the pandemic, they have had the highest enrollment based on the scholarships that we've provided. And they're particularly pleased with the work that they've been able to do to help providers get their credentials there. I'm not going to use the acronyms because I'll get it wrong, but the
AAS
courses,
and ACT.
Thank you.
And also CDAs. Yeah.
Yes. So not only professional development, but also courses that will prepare them for 4-year degrees. So we're really, really pleased, and I want to acknowledge them for the work that they've been doing. The last thing I want to talk about is leadership and financings. We've continued to move forward with both committee work and a steering committee that meets. We've actually just pared it back to once a month. At one point, they were meeting every week because we felt like we needed to provide support to the child care provider community. Our staff have engaged in, at some points, they were weekly sessions with providers on Monday afternoons. We've pared that back a little bit now to once a month, or once every 3 to 4 weeks. And that's all to help give them the information they need in order to navigate during this process. Our financing committee continues to meet to look at making sure that we not only can plan out where we want to be in the next 5 years, but also begin to talk about ideas that we hope to bring back to the county executive and the county council for how we might continue to fund this work, and also how we might continue to work with philanthropy to advance this work. So I think I covered all of the basic areas of the initiative. I'll stop here if you have any other questions.
Seeing no questions, thank you very much for that, covering the first section. Councilmember Navarro.
Just very to wrap up my questions, et cetera. So when we have a subsequent session, I would love to see the mapping of where these new slots, where these family childcare providers or any other providers, where they are. That would be really wonderful. And then if we could also have, I think, a session to talk a little bit about those other funding sources, those other possible, supports that might be coming from the federal government, state, philanthropy, et cetera, sort of like the full picture of where this is headed, I think would be super important. And again, I'm just trying to understand through the lens of racial equity and social justice, how are we doing through that? With the pandemic, every week we see these really important maps of where the cases are, where folks are being vaccinated. We can track with zip codes. We kind of can see all of that. I think that is also a very important tool that we should look into as you're, seeking this consultants, so that we can very quickly, it's so useful to very quickly be able to see, where it is that we need to do a better job. Where is it that we still have gaps, or where have we made progress? So if we could also take a look at that as you're seeking this funding for technology and working with DTS, can we explore having that kind of a, portal, if you will, framework included in that as well? Thank you so much.
Thank you. Very good points. Lots of good and important follow-up. So we'll work with Ms. Yao on getting those scheduled as soon as possible.
Mr. Chairman?
Yes.
I just want to add on to that, and I think this was embedded in what Ms. Navarro was saying, but that supply-demand study metrics, I just would like to see that. And I think you could send that over before, but we should discuss it at this same follow-up. And then to your point, Ms. Barnes, I think many, Councilmember Alvarez and I for sure, but everyone on the council who has kids, and everyone knows everyone needs childcare. And that 5% number, I'm assuming part of what we want to find out is, what is the relative need? You said 15%, but that's just, yes, that sounds good, but we want to know more about what is the relative need at what price points. Obviously everyone could benefit from it, but I'm assuming that's part of the information you're hoping to glean as well.
Yes.
Okay. Absolutely. Okay. So I look forward to the follow-up. I just wanted to be clear about that. Thank you very much. Thank you, Mr. Chairman.
Thank you. It'll be interesting to compare because, obviously the world has radically shifted in the last year. So I think the need has likely shifted as well. So it's timely for us to have this information, and as a baseline moving forward, even more important. So, all right. Thank you all very much. Ms. Yao, what's next? So
next in the packet is childcare subsidies. You've heard a little bit described about it from Ms. Barnes, but for 22, the budget for the program is $3,346,273 and 7.5 FTEs. It's a slight decrease of $12,357 or 0.4% below the fiscal year 21 level. And there is no change to the number of FTEs recommended. The decrease is reflected as multi-program adjustments. The Child Care Subsidy Program administers the county's WPA program, as well as a supplement for children, families who are eligible for the state scholarship program and supplemental payments that support those kids. The table in your packet shows the budget and expenditures for WPA, the state subsidy supplement, and also contributions from the ECE NDA for fiscal years 2021 and 22. because we learned of a correction to that ECE NDA table, there should be a corresponding change in this table under the fiscal year 22 recommended. It should be reflected as 4.5 million as opposed to 3.75 million. Ms. Barnes noted this, but because the state has been increasing both eligibility and reimbursement rates in recent years, we're finding that county children are often no longer qualifying for either the WPA or the state supplement program because their state benefit is higher or equal to the WPA benefit. And thus the ECEI steering committee is considering whether to expand WPA eligibility up to 400% of the federal poverty level, which is consistent with the county's self-sufficiency standard. One question that council staff had, in addition to looking at expanding eligibility, was, usage rates for the lowest income children in using the subsidy program, and whether there needs to be any kind of adjustment to the reimbursement rate for these children, or alternative programming to make sure that these most vulnerable or low-income children can access high-quality care seats.
Thank you, Ms. Yao. I do want to make a note as you look at the table that's in the packet. Our expenditures in FY20 and FY21 were both impacted by the ability to get federal reimbursement for much of the work that we did. So while the numbers in the table look small, that's not what we spent. For example, we spent $2 million over the summer to help support child care providers from when the pandemic started up to July 1 by continuing to reimburse them based on their enrollment as of the day the pandemic started. In July, we made changes to go back to payment based on actual enrollment, as child care had been given permission to reopen, although at a lower capacity. So all of those expenditures that we made to support families who were still working and to support providers who were trying to keep their business open to serve those families were ultimately transferred out because it was federally reimbursable. So I do want to make that clear. In terms of usage rates, and particularly the usage rates in the lower income families, one of the things that we would like to, I believe we've completed our analysis of and now need to move to implementation, is increasing the reimbursement rate for the lowest income families. And that would be even as a supplement to the state program and for those families that qualify for WPA only. Right now, our rates start at 80% of the average cost of care. We believe it's time to move that up to reimburse at 90 or 95% of the average cost of care. And we'll probably do one last round to make sure we can't move it up to 100% of the average market rate. I'm sorry, I said cost of care. It's the average market rate. We base our reimbursement on the market rates that are published for Montgomery County by the Maryland Family Network. And I think that's a key point to make. We have not yet made the jump to reimburse our providers based on cost of care. And that's why the cost study that we did in 2017 and now need to redo is going to be critical, because if we can increase the rates for families that are of lowest income, those families that have high needs, we can get those children into quality care without the parents being so consumed by what they still have to pay out of pocket. We cannot totally eliminate out-of-pocket costs if they're in the state program, but we could continue to raise our reimbursement rates for providers so that our children in low-income families will have the ability to go to high-quality licensed care because we can help pay for that. So that is our goal for 2022.
Let me just say just really quick that is awesome. And that in addition to the child tax credit that the Biden administration is actively pushing for beyond just this year would be a game changer. And I think we need to, and to a point that Councilmember Navarro made earlier about philanthropy, she's absolutely right. I have observed, as all of my colleagues, I know Councilmember Jawando and others have been working very much with the philanthropic community. There's much greater investment being made locally than there was prior to the pandemic. There's finally an acknowledgement of the need that is occurring here. So I think if we can connect these dots to this broader universe, we're going to be able to pull a lot of families out of poverty, and that's significant on a lot of different levels. So I'm excited about that direction because I think it will be leveraged even further with some additional resources that I anticipate will be coming in.
So that's my comments on child care subsidy. If there are any other questions, I'll gladly entertain them.
I guess just the one question that I don't know if it's a question or thought. There are a lot of families who have pulled back from accessing government services, whether they be at the municipal, county, state, or federal level because of a concern of how it may impact or their perceived impact on charge and their perceived impact on families that are trying to go through the immigration process. And so as we make more government services and programs available, it's going to be really important that we continue to deliver that message that you not only qualify for this, but it makes a heck of a lot of sense for you to access it. I think those messages in tandem, and that can't just be done through county government. It has to be done through our community-based organizations and partners and community leaders who've spent generations building community trust. But we're not going to maximize these programs if we don't deliver those messages as well. So I think those are just an additional point as we think about marketing and outreach and the inclusion of the translation services. They have to be culturally appropriate, and that's part of being culturally appropriate.
Thank you.
Remember, yes, I just want to underscore, I think that is a conversation we have been having increasingly, especially around this issue of public charge, which has gone away, but there's still a lot of misperception about it and a lot of anxiety about it. Our community partners, the census team and OCP and that group that is working so hard to do work on the pandemic and getting folks vaccinated is talking about how to carry that message. We're trying to push that out to the hubs and through all of the community-based resources and providers that we've stood up over the last year to get that message out that this is no longer a real thing and that there is help available and you don't need to be afraid of.
Appreciate that. Councilmember Navarro has a question.
No, just to follow up on that, Chairman Albornoz, so important. Ms. Barnes probably remembers way back in the day, Centro Familia hosted a task force on childcare issues in the immigrant community. And I actually took a look at that report not too long ago, and lo and behold, many of the recommendations very much apply today. So that messaging that you were just alluding to, Chairman Albornoz and Dr. Kroll, is just so critical that it be delivered by members in the community that work in the space or perhaps work with the community, because I remember how important it was to make sure that folks understood that this subsidy is for the child, that the child is the one who, especially folks who may be going through immigration proceedings or anything like that. But it is tough. It is really tough to convince people that indeed they should do this. And but there's been a lot of work that has been done in this space. And as it was said earlier, when we talk about nonprofit organizations, et cetera, we need to ensure that these are organizations that have leadership and also staff that already has that kind of trust in the community to be able to go directly. And again, big up and kudos to everything that has been done during the pandemic, because we have a robust template now We really do, to be able to start adding some of these policy areas to that. But most certainly, I think now more than ever, that's going to be really important. Obvious to say that when that task force, when we put together that task force and produced that report, these communities were, growing. But to look at how exponentially they have grown now, really, really calls for a robust response. So anyway, I know Ms. Barnes hopefully has all of that information somewhere, but we need to kind of dust it off and figure out how we then scale it up to address those types of challenges. Okay.
Thank you.
Great. I think that's it on child subsidies. If we want to go on to the next topic.
Okay, so the next program is Early Childhood Services. For this program in fiscal year 22, the budget includes $11,242,155 and 42.83 FTEs. It's an increase of $938,720 or 9.1% and 4.5 FTEs from the fiscal year 21 budget. The table for early childhood services in the packet shows the adjustments proposed by the executive and their review status. So 4 of the items are on the consent budget for HHS, and 3 of them were basically ones that the council had reviewed and approved during the fiscal year 21 savings plan. One of them is multi-program adjustments. There are 2 that are before the Joint Committee for review today. One of them is an increase of $442,000 for, again, we had mentioned infants and toddlers translation services and the need for that. Ms. Barnes explained what had happened with, the requirement for having these translation services for the different documents that are required through the infants and toddlers program, and that we had received one-time state funding, but that's gone away. So there's a proposal for an additional amount in local funding to support this very important required mandatory service that is needed for, again, our diverse infants and toddlers families. And the second item is a $50,000 increase to enhance the Healthy Families Montgomery contract for intensive in-home visits and services. The reason behind this is that this funding has only been increased incrementally over the last few years, and as a result, it's not keeping up with the need for the services. So this additional funding is needed to maintain the appropriate level of services for these vulnerable young children in the county. So with that, council staff recommends the budget for the ECNDA above, as well as the executive recommended budgets for childcare subsidies, as well as early childhood services.
So colleagues, without objection, do we support those recommendations? Seeing all head nods. Great.
The next part of the packet is really just an update on Head Start and pre-kindergarten services that's proposed for fiscal year 22. And that includes the funding that's available for the services both in MCPS and HHS. So it just describes at this point where things stand. And there's also an update on the education blueprint for Maryland's future. With Kerwin, there was some legislative changes during the state session that needed to adjust timelines because of the pandemic, set things back. So there's just an update about the different timeline changes in the new legislation.
Councilmember Chairman Rice.
Thank you very much, Mr. Chair. And so, Ms. Barnes, this question is for you because I know that we've been following, we've worked together on this for quite some time in talking about the recommendations of the Kerwin Commission. Where are we in terms of specifically with our eligible private providers? I know that we had talked quite some time ago when the blueprint first was passed about ensuring that we were ramping up efforts to provide support for those private providers, understanding that they would be expected to bear the large burden of the responsibility when it came to the expansion of slots. I know that COVID has happened and that through alerts and a lot of preparation. So I'm just curious as to where we see ourselves now, and are we prepared and ready for some of the expectations that will happen this fall and into coming years?
Joanne, do you want me to do that?
Thank you. Yes. I would say before I turn it over to Dr. Andrews, I think a lot of what we've done communicating with particularly center providers is to help them see where they can be part of the expansion of pre-K in Montgomery County. That's been a big task. Initially, when this conversation started, many of our providers saw it as a threat. But from our perspective, with the right support and particularly training of staff to help them reach higher levels of excels, we can see our providers participating in the expansion for pre-K. Now, another area that we would like to see is inclusion of our family child care providers in that expansion as well. We haven't worked out all the details of how we might see that model go, but I would say that our expansion, we hope, would include both center providers as well as family child care. Dr. Andrews?
Thank you. The couple of things that I'll mention is that as soon as the pandemic started, the services that we provide in early childhood services all moved to virtual. And that includes everything that happens at the Resource and Referral Center. And interestingly, we've even had, increases in participation in what we offer for two reasons. One is it's virtual. You don't have to get somewhere at 6:30 at night after caring for children all day. And you can have more people in a virtual setting. But also because I think people took, especially if they didn't have a lot of children or if they were closed, they took this opportunity to build on their professional development. So we have continued doing the work that we always did right along. We've just moved it to virtual. So we consistently work with people on moving them up in Excels. There is one leap to get people from when they register for Excels and when they get to level 3, and then there's another leap to get them to from 3 to 5, which does include accreditation. And if you get to a 5, you have to have 60% of your center-based program has to be degreed. And so one of the biggest issues really in Kerwin is the requirement of a degreed certified teacher. So the other thing that we're doing is we're working on putting together information that prepares us for Kerwin because it's been, they're now pushing forward. And how, I'm sure the school system is having conversations, and we will have them as part of the initiative in terms of how the school system will meet what is required of them out of Kerwin coming down the pike. And then we also have to concurrently figure out how we're going to meet that with providers. Our work continues. That degree is going to be a major issue in terms of how many programs can take part in public pre-K. And as Joanne says, we also want to help family childcare providers take part. As Joanne mentioned earlier, we're having more people graduate with the scholarship at Montgomery College. More people graduate if they graduate with their AAT, they can matriculate to a number of programs, including Towson's AAT, which is the certification program. But we're probably going to need to look at supports for 4-year programs, whether that's they've transferred or whether that's they simply go to a 4-year program and get their degree. And I think that's really that and what level Excels they're at are going to be the two biggest pushes to be prepared for Kerwin. So we're doing some analysis of that right now, and we should have some more information about that soon.
So then my next question becomes whether or not we need to devote additional resources to ensure that we're ready to go. I'm curious about the scholarships and whether there's a waiting list when it comes to those scholarships, whether there are people who still want them who can't get them, because again, I want us to be prepared, and we have an opportunity to get ourselves in a position to where we can jump ahead of some of the requirements and some of the stumbling blocks that we know existed. We talked about them when we had our meeting with Kerwin. And so from that perspective, I completely hear you and agree with everything that you said. So the question is, how do we ramp this up? How do we get folks prepared? How do we give them what they need so that we can involve them, especially with some of our family care providers? You know, do we need more money for outreach? Do we need more money for, right? So let's talk about that instead of waiting until we get to the point. I'm not saying you are, but I'm just saying that now is the opportunity to do that. So have we thought about that at all?
Yes, definitely. And there are not waiting lists for the scholarship at Montgomery College. Not to my knowledge. Joanne, did you hear anything different in the update we received the other day?
No, I did not.
Yeah, we're doing the contract monitoring today. So in terms of the data from that, we'll have it. But to my knowledge, no, there are no wait lists for that. And they're in fact recruiting people to. They have, you know, at Montgomery College, they have a number of really terrific pathways to get you to a degree. And the scholarship does pay for English classes, and it does pay for CDA, and it does pay for remedial math if you need it, which is one of the stumbling blocks. So, and they're trying to, particularly this year, I believe my understanding was they were finding the people who were 3 courses away from finishing their degree and getting them into the scholarship program and making sure that they complete it. So, and my understanding is in December, they had twice as many. I don't have the number right now because I don't have the data, but they graduated twice as many early childhood providers, early childhood education degrees as previously.
So, Mr. Vice President, I would think that we would want to get that information. So, Dr. Andrews, I appreciate that. Thank you. I'd love to see how many have matriculated on, how many we still have out there that we know, and basically progress. So I'd love to see how many have gone from Excels 1 to 3, whatever the case may be, so that we can get an idea of where we stand in the progress that we've made, so that if we identify where some of those continued stumbling blocks are, we can address them and put the resources there in a focused manner to ensure that we can get as many people to the level that we need that's commensurate with Kerwin funding, and then being able to draw down that funding. So from that perspective, I think our progress is great. It sounds like we're doing some great things. I just need to be able to see it and help all of us understand what progress and where we can continue to do a little bit better. So thank you.
We can get both the Montgomery College, and we do have reports from the R&R of exactly what you just said. So we'll get those over to you.
Councilman Navarro has a follow-up, and I agree, just Chairman Rice on the record with that follow-up request. Councilman Navarro.
Thank you. Yeah, in addition, also would love to see what options there might be for the direct type of support for this, specifically the family child care providers. You know, a lot of times when we talk about the cost of care, there are particular things that add to that. So whether it's, you know, paying for the training or paying for the startup equipment that you might need, or paying for, you know, the kind of toys and the kind of supplies that you might need, et cetera. And with Centro Familia, we had actually particular grants that we used to subsidize that. You know, we had an equipment lending program. We had toys and educational materials lending program, just to do as much as possible to take off the table the, you know, those types of expenses.
Yeah.
And it might be something I would love to hear a little bit about when we have this follow-up conversation that Councilmember Chairman Rice said, that I would love to understand also, you know, what could we also do in that space as we're trying to expand the availability of quality and affordable, geographically accessible childcare. You know, what are some of those areas that we can help those family childcare providers take off of their spreadsheet of costs?
Well, one of the things I haven't mentioned is that the ECEI is supporting that in a number of ways. So all of our licensing required training, when we moved it to virtual, is at no cost to the providers. And we plan to keep it that way. So the ECEI will continue to subsidize that. We're one of the strange places that has to bring in revenue in HHS to continue the work that we do, but we're shifting that now into the sustainability piece of the ECEI. We are also working with the Fire Marshal's office to support the costs of the permitting, which has really gone up since the Fire Marshal moved to permitting. We do provide startup grants for all of those family child providers that we are supporting. And we also pay for their first year of an association to get them engaged in an association. So, and we've done the other pieces. We've done rent relief for more than a year now for the child care and public space program. So there's a number of pieces that either they're part of recovery or they're part of the initiative. That's exactly what we're trying to do, is reduce the cost of care by reducing the cost for providers.
That's awesome.
And we have increased the amount of the portion of our ECEI budget that goes to Montgomery College. I think in our first year it was $500,000, and we've increased that.
That is awesome. So I do look forward to that, comprehensive session, because these are things that, really folks need to understand is happening, so that we can recruit more and more, especially in those areas, again, of the county that we have identified. This goes a real long way. So I'm really, really happy to hear that. Thank you.
Councilmember Rice.
Can I just piggyback off of that? Because I think that that's an incredibly important point. So thank you, Councilmember Navarro, for bringing that up. And then how do we do the outreach to make sure that family care providers, because not all of them are directly connected with you, right? We know that. So how do we do the outreach to make sure that some of those that aren't connected know about the great supports and all these great things that you're doing are out there and available for them? Because I know all of us who are elected who have been at a meeting that happens to have some family care providers will come up and tell me about how expensive it is and how challenging it is and all the things and restrictions that are there. And so how do we get them aware to avail themselves of these great benefits that we're stepping up?
Right. And one of the pieces we do have in place with our Growing Opportunities for Family Childcare, which is our campaign, it's called Go FCC, is community ambassadors or peer-to-peer mentors in the community who are already family providers. And the ambassadors, in normal times when we're out in the community, are sort of keeping an eye out for those people who seem to be caring for children and making sure that they get brought into the fold of knowing what resources we have for them. And those are in multiple languages as well. And when someone comes through our recruitment process, they're assigned a peer-to-peer mentor to help them through the variety of processes that they need. We have a very good, I think we've shown it to you before, but we have a very good chart that shows the process for recruitment and then the process for retention that we could also give to you again.
One of the things I would just suggest, building off of a great model that we have here now, is our a lot of families.
Maybe we can get him.
My video just got disabled. Not sure why. What happened?
You were going in and out, Councilmember.
Oh,
Rice.
sorry.
I think they were trying to make it so they could hear you.
Thank you. Could
you repeat that question from the top, because we missed the bit of it?
Sure.
Okay.
So one of the things that I think it will be incredibly important is for us to try and partner with our regional hubs that are here because of the success that they've been able to have in providing that support for many families with small children, whether it's access to food, diapers and wipes and all kinds of things. So asking that question about where are your children, during the day when you're at work, what are they, and building that connection between those regional hubs as well as our BIPOC health initiatives will really be important, I think, also to doing some more of that outreach. So building on Saludi Bienestar, and the great work that they're doing, AHP and AHI, it's just really one of those where, again, the more we can spread out to have those touch points, I think will be instrumental in continuing to grow that cohort of people who are aware of the things that are out there. And it can help to identify some places that we may not even know exist currently in terms of providing family child care services. So I just think that building off of this model that's already reaching into the community and doing a lot more than we've ever seen in terms of reaching those hard to reach would help us to get more information about what's going on in those particular communities.
Point taken. Thank you both. That was important. Where are we, Ms. Yeo? Anything else on this subject?
No.
Okay.
Okay, so we're then moving on to school-based mental health and support services. As the Joint Committee knows, it's been long recognized the need to expand these school-based mental health and support services, and council members have expressed interest in a more aggressive approach to expanding these services. They're critical, especially because of the COVID pandemic, and the Joint Committee has recently come to talk about the strategic expansion of these services on March 24th, as well as the interest in expanding services in the context of changes being considered to the SRO program. There is testimony in your packet at circles 49 to 56 that support expanding school-based mental health and support services. The one issue that we want to brief for to the Joint Committee is the High School Wellness Center program. The executive's budget includes funding for 4 existing high school wellness centers at Gaithersburg, Northwood, Watkins Mill, and Wheaton, and the budget's included in your packet, in the table in your packet. There's also some additional information about what's being offered at the centers, especially during the pandemic. So you'll find that attached at circle 19 of your packet. But the issue to be briefed is that the Seneca Valley High School Wellness Center, construction on that should be completed, and the center should be ready to open at the beginning of the next school year. However, in the recommended budget that came over on the 15th, funding was not programmed to open the center. We understand that the anticipated cost to open for the full year is $1.142 million. But we have heard that an amendment to the recommended budget should be coming over that includes funding to open the wellness center. So I don't know if Deborah Lambert can give us a sense of what is in that amendment that's coming over so that the Joint Committee can take a position on it. In any case, this addition can be considered, a critical expenditure that would fit within the different categories that the council president had set forth in terms of adding funding to the fiscal year 22 budget.
Ms. Lambert?
Yes, just to give everyone an update, as I expressed to Vivian previously, the executive has approved a county executive amendment for $1,142,397, and the package of amendments, there are some others, is now with our executive staff on the second floor, and this package will be sent to council imminently.
Thank you. I'm going to make a couple of general comments, and then I know Chairman Rice would like to make some comments. I'm not sure if it's about this specific amendment or more general. Mine are more general. There has been a tremendous amount of time and energy spent on this council, particularly through the HHS and Education and Culture committees, thinking about, talking about the behavioral health need of our children, youth, and families. We've got, as we've all noted in different forums, multiple pandemics going on here. We have the pandemic specifically of the coronavirus and the impact that has had from a public health perspective, disproportionately among too many of our families. Over 1,500 people have lost their lives, disproportionately in minority communities. And that has had a direct impact on families. That, of course, doesn't even include the milestone events that have been missed over this last year, the grieving that hasn't been able to happen appropriately because of all the challenges that have been before us, the anxiety of whether or not you're going to get the virus in the first place, and the trouble with the dissemination of the vaccine. So that's one tremendous bucket. The second, of course, is the horrific images we've seen on TV that have really been highlighted this last year, that have shown what we've known for some time of the tremendous tragedy and challenges in our criminal justice system and in policing in particular. And our students, who are home more than they ever have been before, have been exposed to these images in ways that I've never seen before, that all of us are having conversations about, but particularly in our minority communities. And of course, the very appropriate and discussions that we've been having in that space, but that's difficult to process. And then on top of that, some of our communities have been just targeted. Our Asian community, a good example, particularly over this last year. And Chairman Rice mentioned during a joint discussion that we had about this, his concern and all of our concerns about the impact on our children and youth. So every child has experienced just unprecedented trauma this last year. Hard to get your arms around, hard to get your mind around the kind of trauma that our kids have experienced. And so clearly this is an area that all of us are concerned about. I give a lot of credit to MCPS and HHS, who've also been thinking about this a lot. I've had, as well as my colleagues, many conversations, and we could invest $5 million today in this space, and it still wouldn't be enough, to really highlight what we know is out there and what's coming. So I credit all of my colleagues who have championed and pushed forward initiatives to enhance, the behavioral health units that we have in place. I also give a lot of credit to folks like Luis Cardona, who've been in this space a long time, creating relationships and trust. And obviously there are many transitions that are going to be happening, SRO program being one of the ones that's gotten the most attention. There will be many others, and restorative justice is something we've been focused on too. So while we're going to be discussing this within the context of the FY22 budget and specific recommendations for enhancements in positions, to our public who's watching, we know it's not enough. We know that there's more that's going to need to be done, but we are committed to doing that and committed to supporting what's been proposed. And then we'll lean heavily, as we always do, on the experts who are in the field to advise and guide us on what is needed, what is best. And then it is our role as legislators in an oversight capacity to make sure the folks that are on the ground doing this work have the tools that they need to do it. And it's complicated and it has a lot of layers, but clearly this is something that we're all focused on and will be a highlight, not just now, but in perpetuity moving forward. So those are just some general context and comments as we transition to this next item on the discussion. Chairman Rice, and then I know several of my colleagues would like to speak as well. Chairman Rice.
Well, thank you, Mr. Vice President. And let me just say that I couldn't agree more with every single thing that you said. It really is. And I really want to thank each and every one of you, because each of you in your own perspectives have been leading in making these kinds of things happen in terms of focusing on mental health supports, providing supports for students, looking at different kinds of ways in which we can provide
Chairman Rice, we're losing you again.
Therapy and support and not focus on discipline. Oh, sorry. I'm so sorry. I'm going to cut off my video. But let me say thank you to each and every one of you for continuing to be champions. Councilmember Navarro, you, Mr. Vice President, Councilmember Jawando, Councilmember Glass, Councilmember Friedson, and all of our colleagues who continue to think about this every day and think about what it is that we need to do to continue to support our kids. And working together with Councilmember Jawando and really coming up with this kind of way that we charge our school system with needs that need to be there to help support great folks that are committed, like our director understands how important this is. When you have MCPS who understands in their leadership, that understands how important this is, and then will come back to us and let us know what more needs to be done and what the financial are, and if there are any policy changes that need to be made. All of that is all wrapped into what we're looking for in the future in terms of coming out of these kinds.
You're messing up for me, Councilmember Rice. I don't know if it's for others. But.
So I, again, really can't stress enough how important this is based on exactly what you said.
Councilman Rice, we're losing you. I got about 70% of that, but I think
everyone, and there's a lot of work that needs to be.
Absolutely, I think we got the most important parts and I appreciate those comments. Council members Navarro, Glass, and then Jawanda would also like to speak to this. So, Councilmember Navarro.
Thank you, Mr. Chairman. Thank you, Councilmember Rice, as well. I honestly completely believe that we are at a seminal moment right now. I think that we have really carried a lot of water. I know that the HHS committee, the education committee, dating back to at least when I began to work in this capacity as a council member with the HHS committee, but really, I think even before with the Board of Education, focusing on this issue of prevention. So every step of the way, whether it was when we would get proposals to enhance, issues around gang involvement. I know that for me, it was always so important to ensure that the prevention piece, that we kept strengthening that, whether it was the street outreach network or whether it was working on the wellness centers or whether it was expanding linkages to learning. I mean, all of those things, the county council, specifically the HHS committee and the education committee, has had a pretty consistent approach. And I believe that right now, this moment, it's so important because we have an opportunity to be really bold around how do we, number one, leverage what we have, but then significantly enhance what we have to shift this notion of what do we mean about this whole conversation with youth support. It's mental health, but it's also prevention. It's also positive youth involvement. It is also looking at the connection with employment, youth employment. I mean, there's just so many things that come together, and I feel really, really pleased with how MCPS has been really engaged and willing to work with the administration, to work with the various council members who have been putting forth some ways to address that, and really acknowledging that this is that pivotal moment. I have, from the very beginning of a lot of the conversation around SRO, have been on record saying, I am looking for how we move forward with this holistic approach that doesn't just focus on this piece, but it takes advantage of the opportunity and meets the moment to be very bold in how we shift this paradigm within the schools. Yes, it's not going to be cheap. That is for sure. But I think that we have a very important opportunity here. Even if we start looking at it from a phased-in approach, can we make a very important down payment, especially in the schools where we have a particular combination of need, similar to the education and early care and education action plan, where we say, in the next, our goal is that within the next 3 years, for example, I'm just throwing out a number, we have this X, Y, and Z complement in each of these high schools and each of these middle schools. I believe that we can get there, and I am really hopeful that this pivotal moment can really result in a holistic, in a positive, in the type of approach that acknowledges who we are and that sends a message to our young people and their families that we are serious about shifting this conversation into not what we've had done for so many years, which I constantly used to talk about, not from a deficit model, but from an asset model. We've got to be able to see our beautiful Black and brown children as major assets and not constantly talk about all of the negatives and all of these assertions, et cetera. That has to be part of the culture of change. And so I'm really excited. I'm hoping, I'm waiting for the executive to send over what he, said he would send over this week sometime, the framework, as well as then the specific proposal, because during this budget, we have to make some decisions. We know that the school system and HHS would have to hire folks so that when students come back in the fall, they will be able to be welcome with a completely shift in place. And that won't happen unless we get to work right now and we allocate some funding, because we know how the hiring process works. So I, again, urge the executive and the administration to hurry up and send over whatever it is that they want to propose so that we can take a look at that and then enhance if we need to, adopt what we need to adopt and just get it going. So really, really appreciate everyone. Council members, Albornoz and, Rice chairing these very important committees, Councilmember Jawando for really putting this on the front of everybody's agenda. Councilmember Glass for working with the youth on so many issues. I mean, everybody here has put their best foot forward to say we acknowledge that we already have something in place, but it's time to to really truly shift this paradigm and then continue to strengthen it going forward. So thank you all for everything, and again, I'm really hopeful that this can end up being something extraordinary for our county and hopefully something that can become a best practice around the region and around the country. Thank you.
Thank you. Love those comments. And Equin, Councilmember Rice has worked out the Wi-Fi issues in his house, so if you could please enable his video again, we'd appreciate it. Councilmember Glass, followed by Councilmember Jawando.
Thank you very much, Mr. Chair. I'll be brief because you all have said it, I think, very, very nicely, that we are at a critical moment, and the conversation that we've been having for a long time is going to continue, and it's a budgetary conversation about how we ultimately provide the resources for the students who have been demanding them, who we know need them, and that the moment requires of us to allocate. And the mental health piece is not just a priority for our students, but clearly during the pandemic, we know that it gets complicated and students need a lot more support. And I will just again say that I appreciate the leadership of all of my colleagues in so many different ways, whether it has been in the council, on the council, advocating for these changes, whether it was in prior roles before joining the council, working with youth and making sure that they have everything that they need to live fulfilling lives. And I also just want to thank the advocates who continue to engage all of us, educate, and share with us their firsthand accounts of what schools are like in the 21st century and what Zooming has been like over the last year. And those personal stories really have contributed mightily to our public conversation. So I just wanted to thank them as well. But we'll be getting into the details in a few minutes, and I might have some additional thoughts to share then. So thank you, Mr. Chair.
Great. Councilmember Jawando, and then I have a housekeeping comment to make. Councilmember Jawando.
Thank you, Mr. Chairman. And couldn't agree more with all of my colleagues' comments. Our kids, our community, our families have gone through so much, and you laid it out really well, Council Vice President Albornoz, at the beginning. And we've all been trying to deal with, both personally and professionally, how to manage and how to provide those supports, and realizing that, we're probably falling short. I, as a dad, as a parent, as council members, we know that the needs are great, and but it does give me a lot of hope. As Councilmember Rice was mentioning, everyone on this council has made this a priority. I'm glad Councilmember Friedson's here. I know he was here. We worked in our first budget. We prioritized every mind call functioning so that there could be more mental health services right out of the gate. And I could go through everyone on this call. And obviously, Councilmember Navarro for years, for decades, has been prioritizing this as the school board member. And now we're at a moment, I think, to have transformational change and make a massive investment that is called for and needed for our students in the social, emotional, mental health, wraparound services, mentoring, supports. And we've begun this work. We've done many things already, but there's so much more we need to do. And this is the moment. And I'm also convinced that this is the council to get it done. And I'm really excited. And I know Councilmember Rice mentioned this in the midst of his internet troubles, but I'm really looking forward to the feedback we get from this task force that will be student-centered. It'll be almost half students, and it'll work with all and supplement the work that has been done and is being done at HHS and the school department, in the school system, and by my colleagues, and come back and help us enhance a robust set of initiatives and supports that our students are clamoring for and that they need. So I'm really excited. We'll make a down payment today, and certainly in agreement with what's in the packet. But there's going to be much more we need to do. And we're uniquely in a position with that. We'll be able to do some now in this budget cycle before the end of May, but because of the way we're handling the budget, we'll be able to come back in the fall and make additional adjustments and do more. So this is going to be an ongoing process, and just really appreciate all my colleagues. Thank you, Mr. Chairman.
Thank you. Dr. Corl, I think you'd like to chime in.
I so would. You all just have no idea how much my heart is smiling as I listen to you all today talk about this. Just a couple of things. Just going back to racial equity and social justice and the law that was passed, I think, which has been a linchpin for so much of what has happened in the last couple of years, but underscored by all the horrors we've witnessed, and buoyed a little bit by the verdict yesterday that we heard in the death of George Floyd. The recovery is going to be a long process for us, and I've said this way past the pandemic. Recovery is going to be about mental health and wellness and economic recovery, and all kinds of stabilities that the stability that we need to promote, including dealing with the trauma of loss of life and family members, but also the loss of a year. I lament the things that I didn't get to do this year, but there's just things that are just fundamental to our children that they have missed, and their development and their age moves on. So we've got a lot of ground to cover. The racism that you mentioned, Councilmember Alvarez, is significant. The historic racism and disparities in the Black community, but also underneath this pandemic, the resurgence of hateful kinds of messages and attitudes towards our Asian American community are things that we're going to have to go forward with and address in the future. We're driving. This is that moment of change. I think this culture change, but not just in our schools. Our whole system is shifting. And is beginning to recognize the need to do more in terms of development and healthy development, and promoting the well-being of not just our youngest members of the county, but all of them, our adults, our older population, everyone. There's this move, I think, that I'm happy to be a part of and happy to be here now. This isn't just about prevention or diversion from potential engagement with law enforcement. This is really about the promotion of health and well-being in our children. And that's not just a function of what they do in school. It's before school, it's after school, it's all the things that we've talked about around the early child care and engagement piece. We do a lot of things. Councilmember Navarro, you talk about asset asset modeling based on our assets and using our assets. The assets that we have put in place, this county has put in place over years, are there. They need to be built upon. We need to recognize them for where we have strengths and capacity, and build upon those, I think, going forward. And that is the work that we've been talking about for months now, for more than a year now, I think. And working in partnership with MCPS and Dr. Smith and McKnight, we're working to try to put together the team that will lead that change. We are working together to put together the team that will lead that change. There may be some things that we do now, but this is iterative to Councilmember Jawando's point, that there is what we do now and what we do in this cycle in the immediate future. But this is going to be a developmental process. As we understand the gaps and understand the needs, we're going to have to change how we operate over time to do a better job of integrating all the parts that are here, and to emphasizing all the things that we can do to support children and their families before we ever get to the point where we need to have law enforcement in the room with one of our children or our families. And there's a lot that I think is already in place. You've talked about whether it's recovery, whether it's crisis response, or whether it is healthy development and promotion materials and engagement in the community. All of that has got to be built into this now. And it is a moment of change for us. Changing the culture in the schools, changing our culture in the community regarding policing is all going to be a part of that from where I'm sitting now. So I'm happy that you all are engaged in that and happy to be a part of that. Seneca Valley being sent over to you is a part of that. We certainly recognize that each of our schools, in terms of thinking about this as a phased effort and how do we start, each of our schools have a unique set of needs, and we're going to have to build what we do and tailor what we do to meet the needs of the students that are in those schools and the capacities of those schools to respond appropriately. So Seneca Valley is just a starting point and a piece of that. And there will be undoubtedly more change and more work coming as we go forward. So looking forward to it.
Thank you, Dr. Kroll. So I appreciate those comments. Councilmember Novato is going to make a comment, and then I'm going to make that housekeeping thing I was going to say earlier. So Councilmember Novato.
Thank you. I just wanted to clarify that when I referred to the asset model, I was not referring to the assets that we have in our system. I was referring to the notion that oftentimes we perceive and refer to our young people of color, particularly from a deficit model perspective. And we have to shift that. And it's something that I have used as a framework in my own work for many years. This notion that our Black and Brown youth are extraordinary, and we have to look at it through an asset lens. If we don't do that, then we continue to focus on a lot of policy work centered around this notion of, at-risk youth, this notion of hard-to-reach youth, always from a deficit perspective. And that just has to be a cultural shift. And so I do believe that a lot of the investments that we have made have sought to use that framework of seeing our youth from an asset perspective, an asset model. And now we have an awesome opportunity to make a major leap into that area and strengthen by expanding a lot of the things that we've done already, but also thinking through how that culture will shift within our schools, within our community, but always, again, seeing it through that lens of our youth being part of our asset and not seeing them through this deficit perspective and model. So I just wanted to clarify that. This is something I've written a lot about, and I think that it is an important sort of way to check in terms of how us as leaders, how are we doing this through our budgetary process, through our policies. Very much what guided it was my impetus for the racial equity and social justice legislation. It was to shift that culture. So hopefully, 10 years from now, 15 years from now, 20 years from now, we're now using those types of phrases, and that is reflected in the type of investments and the type of results that we have seen. So I really just wanted to clarify that for the record.
Thank you. We appreciate that. So just a quick housekeeping. So it is a little past 11:30, and several of our colleagues have committee sessions this afternoon, and some central staff have to staff those committee sessions, and we want to give them a reasonable break in between. So we're going to try to wrap this session up by 12:30, if not sooner, to give a reasonable break in between. So just for timekeeping purposes, want to try and keep us on track. So Ms. Yao, if we could go through this item and any line items. And of course, we've got representatives here from MCPS who are very much an important part of this equation as well, and have not had an opportunity to speak yet. And so would encourage them to chime in if they'd like to on this or any other of the topics we'll be discussing the rest of this morning.
So what I'm hearing is that the Joint Committee supports the increased funding for the High School Wellness Center at Seneca Valley High School.
Yes.
Okay, great. Actually, we should be able to, I think, wrap up in time. The last item for discussion is the Children's Opportunity Fund for fiscal year 22. The executive's recommending level funding for the Children's Opportunity Fund in the county budget. There's two places where funding is provided. One is through the Children's Opportunity Fund NDA, which is an amount of $375,000. There's also another amount in Children, Youth, and Family Services of $255,000. Council staff had requested some information from MCPS about whether there was any funding coming from MCPS to support the Children's Opportunity Fund in 22, but hadn't heard back about that. So it would be helpful if our MCPS representatives here could speak to whether there is budgeted funding for the program in 22. And then in addition, we have Kimberly Rusnak here, who is available to provide a brief update on recent accomplishments by the program, as well as proposed next steps, what they're planning.
Great. Why don't we hear from MCPS first, and then Ms. Rusnak, and then Councilmember Glass had a follow-up point that he wanted to make on mental health and school wellness.
Good morning. My name is Ivana Alfonso-Windsor. I'm the budget supervisor for MCPS. And for the past several years, we've had $125,000 to support the Children's Opportunity Fund. And that is in the budget for the FY20, that is in the FY22 budget currently. That was moved forward for approval.
Terrific. Don't see any follow-up questions from my colleagues. Ms. Rusnak, if you wanted to make some opening comments, and let me just express my appreciation to you. I was there in the room, for those of my Hamilton fans, when the Children's Opportunity Fund was founded. And, you know, lots of conversations that I had with Councilmember Navarro then when I was still at the rec department, and her leadership and that of many others really got the Children's Opportunity Fund off the ground, and really have been happy to see the evolution. And I know it continues to evolve, but, you know, based on the need as it has grown in so many different areas. But I know you've stepped in and worked with the Black and Brown Coalition to address a variety of needs. And there are many success stories to point to: the Basics Initiative and zip code 20877 with the launch in the upper part of the county, the partnerships that you've been able to engage in with MMF and DHHS and Head Start and many others is really impressive. So I just want to express my appreciation to you and the coalition building that you all have been working on. And I know you've had more success recently in leveraging the funds, which was always anticipated as one of the primary goals of COF. Still more work that obviously needs to be done, but clearly we're moving in the right direction. So thank you for that work, Ms. Rusnak. And if you want to make some opening comments.
Sure. Thank you, Vice President Albornoz. Yes, it's been an extraordinary and unique year for the Children's Opportunity Fund and our community, as we've all worked to, find our way, our path through this COVID pandemic. And it really has exacerbated a lot of the educational inequities in our community. And so we were proud to partner with the Black and Brown Coalition and childcare providers this year to open up and support equity hubs. Over the past year, we have raised $1.3 million, which is more than the Children's Opportunity Fund has ever done. And it really is, I think, a key part of that success has been the partnerships and the work that we've been doing. So working on equity hubs, we also piloted Waterford Upstart, which is a virtual kindergarten readiness program that MCPS is actually also implementing with their pre-K programs, really looking at kindergarten readiness and going back to the proposal we put in front of our policy leadership group 2 years ago of really focusing on third grade reading and understanding that if more of our children are reading by third grade, then all of their long-term outcomes will be improved. And so looking at kindergarten readiness, the social determinants of health, family engagement and supports, and quality out of school time, and equity hubs, and moving into the summer. Everyone is talking about summer. I was just on a webinar yesterday held by the Campaign for Grade Level Reading, and they were talking about all the funding that's coming into the school systems to be spent over the next 3 to 4 years. And I think we're at a critical turning point as we think about how we think about the value of out of school time in our community moving forward. And so to that point, we will be coming back to you all soon with a request to support equity hubs through the rest of the school year. We have funding to get us through the end of this month, but we'll need additional support for the rest of the school year. But then also thinking about what summer looks like and creating wraparound opportunities for families so that when MCPS opens up their summer school enrollment in a few weeks, that families understand that MCPS is offering programming for 4 hours, 4.5 hours in the morning, and then there will be childcare supports that will be supported with scholarships, hopefully, so that families can get access to a full day summer experience that includes academics as well as enrichment, which is really what the National Summer Learning Association talks about in terms of best practices for summer. And then also thinking about moving into the fall and thinking about where do the gaps continue to exist in that out of school time space. But I want to say a special shout out to Councilmember Nancy Navarro for her continued support and the chairs of these two committees, Vice President Albornoz and Councilmember Rice. You guys have been great champions of equity hubs and the Children's Opportunity Fund. So thank you guys for your continued support, and onward. We'll keep moving forward and keeping the kids center of mind as we do all of our work.
Thank you, Chairman Rice and Councilmember Goss. I promise I'm going to get back to you because I know you wanted to make an expanded comment regarding wellness and mental health. Chairman Rice. So
I hope that you guys can hear me.
Yes.
And I'm going to talk quickly because we have a storm that's rolling through here in Darnestown, which always impacts our Wi-Fi. Thank you, Kimberly, and thank you, Children's Opportunity Fund, for all of your great support and all of your great work in standing up with the Black and Brown Coalition to make these equity hubs happen. They are incredibly important. We need to make sure that we're going to continue to support them into the summer, understanding that summer learning still requires additional support. And it's one of those where I know the great work that our teachers do within MCPS and the great supports that they offer to our students. But the reality is that some folks don't have the same time that meshes with where our teachers' availability is. And that even aside from everything that MCPS is trying to do to help support our children may not always work. And so with our kids not being in the classrooms all the time, it's certainly going to be important for us to continue this, not only through this year, but into the summer as well, so that we can ensure that as people matriculate on to next grades, keep in mind, this is incredibly important for all our children that are transitioning, those that are going from 5th to 6th grade, those that are going from 8th to 9th grade. Those are fundamental times. Those are going pre-K to K. Those are fundamental times where we look at those in 3rd grade and 5th grade, where we have those benchmarks that we look at for our children in terms of achievement. We've got to make sure that they've got all of that before we send them on to the next grades, right? And so from that perspective, that's why this is so important. I know that everybody who's on this agrees and believes that that's incredibly important. And so we're just going to have to figure out the right methodology to be able to support it with the resources that are necessary. And again, want to tout and tip my hat to you, Vice President Albornoz, to you, Chair Navarro of Government Operations and Fiscal Policy, but as former board member and everything else, you've been talking about out of school time, and that's the reason why the Children's Opportunity Fund was created in the first place. So it's exactly in line. You know, when I think about Bell program and all this stuff, I mean, it's like, look, this is all culmination of all this stuff that we've been talking about for a while. And thank God that we actually set this up pre-pandemic, because if it hadn't been, that would be so much more work that we would have to do, right? And so that's just being real about the work that we've done to get us to this point that allows us to actually be more nimble and actually make some things happen quickly, like what we've seen. And Kimberly, again, congratulations to you for that great fundraising effort, leveraging public sector dollars with private sector. So I hope that for, as Councilmember Juando always says, the millions that are watching at home and those fiscal conservatives that are out there, here we are leveraging, right, public dollars with private funding for something that we know is incredibly important to all of us. Thank you, Mr. Vice President.
Thank you, Mr. Chair. And I know that there is something cooking in terms of a potential proposal. So we do look forward to seeing it, and obviously working with the executive branch, because as we've underscored many times today and this morning, there's a lot of need, and government organizations alone aren't going to be able to fill it. So I do look forward to ongoing discussions. Councilmember Glass, if you wanted to go back to the comments you wanted to make regarding health and wellness and in general, please do so.
Thank you very much, Mr. Chair. I hadn't expected the previous conversation on the mental health and school wellness programs to move so quickly, aside from some opening statements. And so, you know, I just wanted to come back to that. And, you know, there are lots of conversations, as we all shared, here on the council, within county government, and clearly within the community, about how to provide those support services for our students in need. And I know through these conversations, and has been referenced in the packet, that the county executive is going to send over additional funding for the Seneca Valley Wellness Center, and we appreciate that, and we're expecting that. And I know that there are other conversations taking place as well. I know that council members Rice and Jawando have requested that MCPS convene a task force to talk about school resource officers and mental health issues and support, and whatever else those youth and that task force talks about, and what some of their recommendations may be. But as we have those conversations, there are some things that we already know. And we know that our students need support, and they need support yesterday. And so as we're going through this budget, this FY22 budget, I think the correct thing to do is to proactively put these support systems into this budget. And to put it into the FY22 budget so it's there, so we don't have to circle the wagons and come back to it. You know, again, the process that we have here is in the FY22 budget, we're talking about mental health supports right now. And so I think for everybody and for the process, the best thing to do is to make sure that those funds are in the budget, they're ready to go for when we know what some of the recommendations from task force and other conversations will advocate for, because mental health is going to be one of the outcomes. I don't think there's any doubt about that. And individuals are asking for clinical licensed social workers in all of our schools. And I fully expect that to be one of the outcomes. So I think it should already be in the budget, so that when that recommendation comes forward, we're ready to go. And so I would like to motion that we add $2.6 million to the reconciliation list for a clinical licensed social worker at every MCPS school.
Okay, there's a motion on the table. Is there a second? And then we can discuss.
Second.
All right. Let me just say a few things. Clearly, there's going to need to be a lot of additional support, and certainly in principle, and I will support this motion because I think it makes a lot of sense. I think we do need to look at this within the context of the bigger picture to see how it exactly fits with some of the other efforts that are being pushed forward and are underway. And I'm hoping that the executive, as Councilmember Navarro noted earlier, does move forward quickly, sooner rather than later, with what he has discussed privately with a number of us, and I know is sincere in his interest in trying to provide an additional layer of support as we work through this transition. Because at the end of the day, what we really need are as many caring adults, particularly those that are clinically trained, that are in a position to support our children and youth and help them on the front end, but then make referrals on the back end to other community-based organizations and providers if they need that additional level of assistance. So I think the proposal makes sense, and we'll discuss it as we do every item on the reconciliation list within the context of what's being proposed and how we can partner with the executive branch, and not just how this impacts the budget, but how we may be able to leverage federal resources as well. So those are my 2 cents, but needless to say, this and more is going to be needed in the future. Any other thoughts on this? Councilmember Navarro, and then Chairman Rice.
Thank you. So my understanding was that the executive, and it would have been great to have something to react to by this session. It was my understanding that the executive was going to send something specifically that was going to be holistic. And so, although of course I am supportive in concept of more social workers in our schools, I hope that we will work through this budget with some type of holistic proposal, because at the end of the day, the school system and the administration are the ones that are going to have to operationalize whatever we propose. And as I have expressed before, and it's something that we have discussed, especially with HHS ad nauseum, we do have some challenges with finding culturally proficient licensed social workers. It has just been an ongoing issue that we have discussed time and time again. And so I want to make sure that whatever we end up supporting, and I agree that we have to do this sooner than later. I do believe that when students come back into the classroom, we just talked about all of the trauma that they have been exposed to, that there is already an enhancement. So I want to make sure that as we work through all of this, that we're also looking at the innovative ways that we can address the issue of cultural proficiency. It is critical, because if not, we're really kind of like setting ourselves up again to create a structure where the vast majority of our student population does not seem to get that kind of report or the type of support, because we don't have the appropriate, cultural and linguistic proficiency in this type of service delivery. And that is critical. And so I really want to just point to that as, I'm holding off in terms of things that I want to propose, because I would like for us to do this in a holistic way and not just, propose something that sounds really awesome, but then come back a year or two after this and either be told that they were not able to hire the folks because they couldn't find, enough folks with those qualifications, or that the people that had been hired, unfortunately, did not reflect the population of our school system. And I know Dr. Santiago and HHS has been working on some, initiatives of the sort. There are some models that I think sound really promising. So I just want to caution that hopefully by the time we're done with the budget, that hopefully we have something substantive. And then, as has been said before, we can come back later as well. But I just want to caution this. And, although I won't vote against putting something on the reconciliation list, I want to be on record saying that that we do need to understand that this needs to be holistic, and that we should be consulting with the folks who are going to be in charge of actually implementing all of this, with that very important caveat of cultural and linguistic proficiency, which has been a serious challenge thus far in this whole approach.
Thank you. Agree. Chairman Rice.
Yeah, and I'm going to defer to Dr. Kroll because I know that we've talked a lot about this as well, but I just want to briefly just lead in and say that, look, while I do support putting a placeholder in terms of funds, I don't want to restrict us in terms of saying what those funds will be utilized for, because there's a laundry list. And that's why we're having MCPS create this group of individuals that will come together to identify some of the greater needs that we see in our community, and that we hear from our students as to what they'd like to see. You know, positive youth development and the great work that Luis Cardona is doing in terms of having phishing experiences with people who are being recruited for gangs, or children that are experiencing trauma, and seeing their faces light up is just as effective as meeting with a social worker. They have the same sort of effects to some extent. Not in all of the things from a clinical perspective, but certainly have positive impacts on our young people. And so I don't want to paint us into a box by saying, okay, this all goes to this. So I'm all for saying that, yes, you know, we want to start to put a down payment on some of the things that we are going to need to do. So if Councilmember Glass, that's what you're looking at, then that's a different story from what you just said in terms of having a clinical social worker or even a licensed social worker, or whatever the case would be, at a particular school, because that model, I think, will be determined by the school system and by the children and the community leaders that are working in this space right now. So I don't just want to, you know, so I agree with what Councilmember Navarro said too. I don't want to, you know, lock us in. We need to be mindful and hear from folks. But Dr. Kroll, am I on in terms of where you may be as well?
Thank you, Councilman Rice. Yes, I would summarize it this way. 30 years of research and work tells me that therapy isn't the only thing that's therapeutic in the development of a healthy child, And so while we're talking about the need to do something in lieu of, as we roll SRO programs out and think about something else for around this, we need to be thinking about the behavioral health and the health of our children. That doesn't translate immediately to a clinical licensed social worker. It is a matter of what we need people to do and what kind of relationship do we need them to have with our students. Is it parents? Is it the kinds of things that we're talking about in terms of positive youth development that Luis Cardona is doing? Is it a caring person who's in the hall, who's not a police officer, who's strolling the halls and walking the halls? Is it a clinician who has both some skills to do clinical work, but also some skills to do consultation with teachers about a child who is being difficult, who may be having some developmental problems, who may have had a bad night at home or in the community the night before, to be able to help reestablish and reaffirm a culture, or change a culture that we talked about earlier. So there's a need to grow some things. What that is and what they do is not necessarily defined by the title of the role. We have, to Councilmember Navarro's point, our recruitment of social workers who are culturally and linguistically appropriate for the populations we serve is incredibly challenging. But that doesn't mean that there aren't people that we can't hire who don't necessarily have master's degrees, train them to the skills that we need them to have in the schools, and then engage them with this, help them engage our students. So there's a lot of room in that. So I'm not saying don't put a place marker in, but I am saying we need HHS, MCPS, MPD, our collective work with council. We need the space to be able to figure out what makes sense from school to school to school in some places, but overarching as a model for how we move forward with this. The other thing I will say about place marking in terms of funding is that I know that there is funding that the county executive and the superintendent have been talking about that is coming down the school's path that is COVID related and recovery related, that might be a support for funding some of the kinds of things you were talking about this morning. I don't know what happens if we put funding in the budget. Is that funding then no longer eligible to be used in this way? So it's a question for OMB and for our legal eagles around how we utilize federal funding and whether or not we end up, do we lose the capacity to do that? So it's something I will put on the table for consideration.
Thank you very much, Dr. Kroll. Councilmember Jawando, then Councilmember Glass, and I actually have a friendly amendment to suggest to the Councilmember Glass's motion, but Councilmember Jawando.
Thank you, Mr. Vice President. And I wanted to second the motion so that we could have this discussion. I wasn't aware that of it. I know we've all been talking about the supports, but I think it's important that we're having this discussion. And the answer to Dr. Kroll put it up perfectly. The answer is yes. We need all those things. And I often talk about my best friend Kalfani, who went to school with me and was killed. He needed a teacher who was culturally competent, who believed in him, who knew restorative justice training. He needed a wraparound support for his because he had a single mom situation. So he needed an after school program so he wouldn't get involved in bad things. He needed, go down the list. He needed mentors. He needed qualified mentors, and probably needed a social worker and a therapist as well, right? And so the question is yes, yes, and yes. And how do we set up the right system and supports for every student, for every family? And we've made significant progress in many of those areas already. It's one of the reasons when we introduced the proposal to remove school resource officers that we same time did the therapeutic rehabilitation, the services, the recreational therapeutic services, rather, the restorative justice training that'll train all of our middle school staff, 1,400, and the after school engagement hubs to signal that it's the whole thing. And that was a down payment, but there's still much more to do. And so I would agree with Councilmember Rice and Navarro, and hopefully I think the amendment's coming, that we should create a signal that there's a placeholder of something that we're going to do, but that we don't directly say it's this right now, and let the work happen, both internal and external feedback. So don't want to steal your thunder, Councilmember Alvarez, but I would support something of that nature, and I certainly appreciate Councilmember Glass where you're coming from on this. It's really, really important. So thank you, Mr. Chairman.
Thank you, Councilmember Glass.
Thank you, Mr. Chair. I'm glad we're having this conversation. This is what I thought we were going to have before we quickly moved on beyond the topic. So I agree with everybody's thoughts. The holistic nature of what we're trying to do, what we need to do, letting the task force share their ideas, some of which are known, others are unknown, but they will provide a long list of things that we can do at the council, things that MCPS needs to do. And then quite frankly, to Councilmember Rice's point and Dr. Kroll's point, there are external providers that are going to fill those gaps. Absolutely. As the former executive director of one of those organizations, that's the holistic approach that we're trying to take here. But I do fundamentally believe that we should put a placeholder in this budget at this point in time. I'm very open to amending it so that we understand what we're trying to do and allow the processes to continue without having to restart. But when the task force does share their recommendations, there is money appropriated. And so however we want to word it to allow this process to move forward quickly after the community input shares their recommendations, I welcome that. So I think your friendly amendment before hearing it will be friendly accepted, but I'll turn back to you, Mr. Chair.
Thanks. Just for context, for the dozens watching right now, there's a couple things going on here. One, it's been reported to us by the county executive that he's working closely with MCPS on a holistic proposal, a joint proposal between HHS and MCPS to provide more behavioral health support within our school system. So that's what Councilmember Navarro and I were referring to, and I think others as well. So that is coming, and we're anticipating that. And our hope is that will include what you have proposed, Councilmember Glass, which is the addition of more behavioral health specialists, including social workers, because there's a lot that needs to be discussed on who they report to, what the scope of their work is, where the referral process is, all very relevant and important to consider as we transition these positions so that they're put in the best possible position to succeed, and notwithstanding the challenges with regards to, whose budget they're going to be in. And so that is being worked on right now. And then as we know, Councilmember Jawando and Councilmember Rice are working on a student-focused effort that we're anticipating will also solicit important feedback that will be weighed as we figure out, where we go with this. So yes, that is the friendly amendment, that we come back to this recommendation after we've had a chance to absorb and see. We are scheduled to meet again as a joint committee. And so I think there will be an opportunity, another bite at the apple before the budget process ends and before it goes to before full council. And maybe this will put a little bit of wind behind the sails of the executive, encouraging them to, present this proposal sooner rather than later. But full credit and thank you for acknowledging and bringing this up, because it is really important. And if we come back to this and there isn't something that we're thrilled about or support, then I think we absolutely should and have in many other instances. School health nurses is another example, a good one, where we've proposed and have not been satisfied with what's been proposed. So I just, if we could put a placeholder on this for now and come back to it when we come back to it as a joint committee, that'd be great.
So just so I understand, so the friendly amendment is to not add the 2.6 million to the reconciliation list. Right?
At this point, that doesn't mean we won't be adding it later, but at this point, until we see, what the more holistic proposal is that folks on the ground are working on.
I don't agree with that. I think now we're having this conversation now. If we want to amend it, if we want to have another conversation later, incorporating whatever the executive and MCPS send over, but this is the part of the budget that is germane to this particular funding item.
Councilmember Navarro has her hand up, and then Chairman Rice.
Yeah, I mean, I guess I'm trying to follow the bouncing ball. So what I heard Councilmember Glass say was that the task force that Councilmember Joanna and Councilmember Rice proposed that would be student-centered is definitely going to be coming up with some additional recommendations. The timeline there, as I read about, was that they would come back with recommendations in June, I believe. And so therefore, yes, there would be opportunities to even through I don't know, special appropriations or something like that, a process to fund appropriate recommendations. So saying that we're going to put something on the reconciliation list for that predetermines or supposes outcomes from that task force, where I think at this moment in time, this is our first joint session. So, the executive has signaled, I mean, I have not received the proposal, but has signaled that within this week, that there would be something that he would be sending over, which would be, something initial to begin to strengthen. And this is something that they're working on with the school system, strengthen those supports in the school system. So I assume that's going to come with a particular request or some kind of amendment to the budget, which we should look at. And then, we'll come together, take a look at that. Like Councilmember Albornoz said, we may want to enhance that. We may think that that's enough. And then when the task force comes forward with recommendations in June, then we would have to meet again to figure out whether there needs to be a special appropriation. But I just don't know why we would put sort of the amount that you just proposed, because I haven't seen that amendment earlier, for something that hasn't even been convened in order. We don't know what the recommendations are. So I feel like, we have time to be able to react to whatever the executive has vetted with the school system and HHS, see what that is, deliberate, vote on that. And then we can either fold in some, this or not, or wait. But I just feel like it's a little premature. It seems like, for example, our staff has not been able to vet this. I know this is the first I heard that this was going to be considered today. And I feel like the process is the process and we'll be able to address it. So, I'm not opposed to us putting more money. I just don't feel like this is the right moment, nor do I feel ready, given that we're going to be receiving some other proposals pretty soon from the executive, which the school system has been working on as well.
Yeah. Mr. Chair, could I respond?
Sure, and then Chairman Rice has a comment. Mm-hmm.
Sure. So Councilmember Navarro, I appreciate it, and we all know that the task force is going to provide a lot of different ideas and suggestions, but for the last year and a half and more, we have been talking about mental health support and about having school-based mental health support. And so I don't think there is any disagreement from anybody that that will be one of the recommendations. And I would be, I think something would be amiss if that were not one of the recommendations. And all that I'm saying, and has been said by our colleagues, is that this is a down payment to get it in the budget. I think that's what the process requires. It might require more, and that would be supplemental. But here on this day and this joint committee where this is the topic, I think it is important to put this on the list as something that we know that is needed. And there's no doubt by any of us that this is something that's needed. The process clearly with the executive and MCPS, there's still work in that process. But I think for our due diligence, this is the right thing to do at this point.
Chairman Rice.
Well, that's one way to frame it, but I think our due diligence should be to be able to hear from the administration and MCPS as to how they would be implementing something of the sort versus being prescriptive at this moment in time when we know that we have a proposal coming that might incorporate what you just said, but would be a lot more holistic. So I am not disagreeing with you that we have discussed this for now a couple of years, and that we have said that we want to work towards a lot of this. But to say that we're going to invest this money specifically for licensed social workers, when we have already heard from Dr. Kroll that there are some things that they're working on that would address the issues of cultural and linguistic proficiency, which is kind of critical given that 73% of our student population is BIPOC. I think it's important to hear and see what the broad proposal is going to be, and then be able to put the funding in there. It doesn't preclude what you're just saying, but I did not see this in the packet. I didn't know that this was coming. I thought that we were going to come back. I thought the chairs understood that we were going to come back to kind of focus on this in a holistic way. And so that's all I'm saying. I'm not saying that I disagree with your assertion or your assessment. I just thought that we were coming back for something a lot more holistic. And so, it's up to the chairs, obviously, but it's just it's an odd way of going about something that we all said we were going to work on in a much holistic way. We would hear from both MCPS and administration. And also, as has been discussed, this issue of a task force that is also going to come back later on. So there seems to be several process issues here, and I'm just trying to follow the process.
So real quick, I'll make a motion here, but just to correct the record, I am not a chair of either of these committees, so I haven't been privy to some of the conversations that have been taking place about what will and was not to be said, what's discussed in this session. What I will say is the packet is full of public testimony that we have heard of requests for social workers, and the $2.6 million is referenced in the packets, and it has been referenced in public testimony. And so it is a part of the record in this really important conversation about how we provide support services for our students. So what I'll recommend here is I'm willing to withdraw the motion contingent upon the county executive, as you're all sharing, that he introduce an amendment to the budget that holistically or not incorporates this need and drafts it in such a way that it is flexible enough to meet the needs that we expect to be requested by the task force and the specifics that the task force will actually ask for.
Councilmember Glass, I really appreciate that, because I think everybody is pro social worker and pro wanting to enhance behavioral health and social supports for our children and youth, as we've all eloquently, and I think others better than me, articulated the needs that our students are going to be facing coming in. And certainly we've been hearing from the community. You're absolutely right about that. I think I'd like to give the executive branch a little bit more time, acknowledging that this is for FY22, right? That we're not, the task force that we referred to earlier. I don't want to make this sound bureaucratic. Like we know there's urgency and we want to get these positions in as soon as possible. Totally with you. I think we all universally agree. I think just figuring out where exactly these positions would fit is important. because it may mean help in other areas, and how this fits in with linkages, and how this fits in, with the street outreach network and the community-based organizations who are already in the schools. Like, there's this really important ecosystem where if you just add a position without a deliberation and discussion on how it will fit within that ecosystem, in some ways I've seen, and you've been in the youth development space too, without thought given, on the front end to that, you may sometimes unintentionally create more problems than you're trying to solve. So I think we want to add these positions, no question. The question is how and where, not when, how and where. I think we're all on record as wanting to do something for this upcoming fiscal year. So I appreciate you pulling it for now, acknowledging the urgency of coming back to this in a way that makes sense and works. But Chairman Rice.
So part of this conversation has actually started to get a little troubling. And the reason why is because we don't dictate what happens in the school walls. That's the school board. And they're an elected body that decide that. We can't make decisions for them. This was all supposed to be collaborative, which is why the task force was designed in such a way when Councilmember Joando and I created it to be led by the school system and school students, because they need to have a seat at the table in terms of what this is going to be. I can't force a person to walk into a school and say that they're going to be in, they're going to have a seat and they're give them an office and all this. There are so many logistical challenges that are involved in this, and it needs to be with their involvement. So outside of all the things that you heard before, there's also the respect for the school system in terms of them having a seat at the table and determining a strategy that makes sense for delivering to them. And MCPS, to their credit, has already embarked on Be Well 365 and a lot of the things that they need to do, and created investment and talked about stepped up investment when it comes to the mental health and well-being of kids. So let's bring all that together, right? Which is what I think the task force was designed to be able to do, and then say in conjunction with putting placeholder money that the county executive is looking at in anticipation of what some of the things will be there, will be enough to get us there. But let me just remind you, Councilmember Glass, you've got 5 members on this joint committee right now that are all in full support. That's enough to make any appropriation happen at any point in time. So if we are all, and I've heard from each and every one of us, committed to making this happen, we can do it, and it's guaranteed to happen at any point in time. So there is no rush. Typically, what happens when we put placeholder funds in, at least in my experience on the council, as well as in the state delegation, was because we were concerned about funds not being there. There's not a single person who doesn't agree that this is a top priority and that this needs to happen. You've heard Councilmember Navarro talk about special appropriation. I've mentioned it. Councilmember Joando's mentioned it. Councilmember Albornoz has mentioned it. So from that perspective, we've got 5. And one of the things that my chief of staff, Steve Goldstein, always told me is, Craig, all you have to do is be able to count to 5. Math isn't complicated. And so from that perspective, we're already there. And so I don't anticipate anybody falling off. Everybody's already been on record in terms of saying that they're committed. And so from a timing aspect, it is not something where we have this fierce urgency of we have to do this today versus doing it appropriately when we have all of the recommendations that are there, and fund everything and fund it all. Because I'm raising my hand. I'm saying this in public right now, that I'm sure somebody's recording, because that's what folks do now. And they're going to hear, and they're going to play it back and say, Craig, you committed, you were going to support this. I'm saying I'm supporting it. It's the reason why we created the task force. I didn't want a task force to be there to just give us recommendations and then not fund them. So I want to see it happen. So let's let the process play out. Let's let the school system and the students do what they need to. And let's encourage the county executive to lay down some funds that will be there just to establish, because there are some things that we may be able to get rolling now. And the school system may say, look, these are some things that are easy pickings, low hanging fruit that we automatically know right now, regardless of what the task force says we want to move forward with. And let's do those and fund those and find out what that number is. So that's what the work is between now and what Chair Albornoz was saying is that next meeting. So let's fund that part and then come back when the task force comes back with its recommendations and say how much more we need to do. And let's fund that too. So that would be my suggestion, Mr. Vice President, Mr. Chair, to you, Councilmember Glass. Appreciate the fervor and the energy around this. It's incredibly important, but I think that we do need to take the steps proper, being respectful of the agency that MCPS is and the process that involves some of their key stakeholders, both within MCPS and in our community as well.
Thank you. Councilmember Juana wanted to make a couple comments, and then I'm going to wrap this one up.
Just as the seconder, I agree with the withdrawal. I appreciate Councilmember Rice said many of the things I was going to say as wrap up. And I think the good thing is we're all in vigorous agreement. It's just about, we got to figure out how to get this done, and we will get it done in time for things to be in place, the start of things to be in place by the time our students get back in place. And you've heard that commitment from everyone here. I'm really excited about that. I know our partners at HHS and MCPS are excited about that, and look forward to seeing what the county executive sends over. And appreciate Councilmember Glass raising it so we could have this discussion in open setting. And I think that'll be helpful to signal to the public, to the millions, not the dozens, Mr. Councilmember Alvarez, the millions that are watching. Thank you.
Thank you. So thank you again, Councilmember Glass, for initiating this discussion. It's really important. We are going to come back to it. You have that commitment by both chairs. And so we're talking about a matter of weeks, not months, and that this will be in anticipation of the recommended FY22 budget that we end up presenting to full council. So thank you again. Appreciate that. So Ms. Yao, was there anything else that we were going to discuss this morning?
No, I think we've covered everything.
Okay, and probably then some. So thank you all very much. This has been great. We will be reconvening again in the near future to follow up on this and numerous other